Atul Gawande is a renowned author, surgeon, and civil servant. Having worked in the field for his entire career, he possesses crucial insight and knowledge to propel the next generation of not only healthcare professionals, but leaders. Gawande's book, Complications: A Surgeon's Note on Imperfect Science, is a masterfully written book discussing topics ranging from research in history to vivid descriptions of surgeries. To analyze and closely read Gawande's entire book would be a monumental task. For that reason, a smaller passage of Gawande's book has been chosen. This section, along with others from his works, highlight important themes and lessons that are crucial to understanding the field and the psychology behind healthcare. Gawande's work is a prime example of a book to be studied, and the section discussed is of great importance. The selected passage highlights the pervasive theme of uncertainty in medicine and its profound impact on both doctors and patients. This passage is presented near the end of the book and consists of the first three paragraphs of the chapter titled The Case of the Red Leg. Overall, this passage reads as a sort of warning to the reader, consisting of words cautioning the uncertainty that presents itself in medicine. Gawande is writing from his experience, and this section heads the description of a case where this very theme is deeply explored. However, I believe that much of the value from this chapter comes from these three paragraphs. The passage can really be broken down into three distinct paragraphs that complement each other to form the larger theme. A closing statement from the last paragraph highlights this section's theme and overall style. It reads as a doctor, you come to find, however, that the struggle is caring for people is more often with what you do not know than what you do. Now, this statement highlights the uncertainty and complexity of diagnosing a patient. Statements like this envelop this passage and transform it from a simple introduction to a sophisticated and deep look into the pervasive realities of being a doctor, with much of this passage playing into the larger narrative of the book. This passage greatly contributes to the broader narrative of the book. A general theme throughout the personal narrative sections of Gawande's book is the aura of uncertainty and the feeling of regret. He highlights these moments through vivid descriptions of surgical operations and personal moments with a patient. Oftentimes, the phrase, "I don't know," is not directly said by Atul in his stories. However, looking deeper into the pages, it is clear that there are many instances of uncertainty. I believe this too plays perfectly into a quote from this passage. Medicine's ground state is uncertain, and wisdom, for both patients and doctors, is defined by how one copes with it. Uncertainty is mentioned again as a main cause of skepticism and doubt in a doctor's life. This concept is totally understandable when one looks at the conditions doctors work in. Oftentimes, the doctors are the only thing between a patient and certain death. This leads to an important section of the passage in which Atul describes different scenarios in which the attending doctor always replies, "I don't know." To someone who isn't in the medical field, this came as a shock. It is an important frame of reference for the rest of the passage. I also believe this was included to show the human side of doctors and familiarize the reader with the idea of not knowing, especially in a field as sterile as healthcare. Furthermore, during this passage, "What's this pain I feel next to the wound?" There was the patient 1 month after a gastric bypass operation. "Why haven't I lost weight yet?" Now, these realistic questions asked during the passage by the patients and the exams also help to strengthen the relationship between not knowing and practicing medicine. While these questions don't seem that complicated, the answer cannot be realistically determined based on one doctor's assessment. Thus, Atul included "I don't know" to represent the collective uncertainty in diagnosing patients' qualms. This also leads into the doctor-patient relationship, which is heavily discussed throughout the book. In many other instances throughout the book, the main focus of a scene is this relationship, uncertainty and all. Gawande is able to capture the intricate moments of shame, fear, and pain. He does this with the help of an expert using tone, language, and style, which he displays brilliantly in this passage. For example, the excerpt I do not know. These are four little words a doctor tends to be reluctant to utter. Now, in this excerpt from the passage, Gawande uses specific vocabulary like little, and utter. These play their part in strengthening the message behind what he has written. That being said, doctors often stray from the use of these words, but they still hold deep significance in the field of medicine. Lastly, this passage does a great job of progressing Gawande's argument for a more open and honest state of medicine. These points are brought up many times in previous chapters of the book, each time progressing the argument for a better industry standard on honesty and admittance of mistake. For example, in the part of the book where Gawande mentions the meetings where hospital staff discuss the mistakes they made, or the cases where a surgeon lost his liver. These examples are highlighted and progress through this passage and serve as a springboard for Gawande's ideas of a better future. In conclusion, Atul Gawande's work, particularly the selected passage from The Case of the Red Leg, encapsulates the pervasive theme of uncertainty in medicine. Positioned near the end of the book, these 3 paragraphs serve as a warning, shedding light on the challenges doctors face in navigating the unpredictable nature of their profession. This passage contributes significantly to the broader narrative by exploring the nuanced interplay between uncertainty and the doctor-patient relationship. Gawande's adept use of language and style humanizes the medical professionals, emphasizing the significance of acknowledging uncertainty. Furthermore, the passage acts as a linchpin in Gawande's argument for a more transparent and honest approach to medicine. Linking examples from earlier chapters, it leaves readers with a thought-provoking question about the impact of uncertainty on the doctor-patient dynamic and the broader societal perceptions influence the challenges inherent in medical decision-making. Lastly, some questions that I believe can further the analysis of this passage. Number 1, how does the portrayal of uncertainty in medicine impact the doctor-patient relationship throughout the book? Now, I didn't go into specific examples, but I think this question can be deeply considered, and there are many examples throughout Atul Gawande's book. Question number 2 is, in what ways does social perception of medical professionals contribute to the challenges of navigating uncertainty? Now, what I'm getting at here is, how are people in, say, different countries or different societies viewing these doctors, and how does that really affect what they're uncertain about? And I think that all comes down to where someone's born, maybe access to healthcare, and then really just what they were taught to believe about doctors. So that concludes my speech, and I'd like to thank you for listening in, and have a good rest of your day or night.